I think that nursing is more art than science. I stand on science. I stand on all those things that I know that happen physiologically in the body, and I encourage people, don't run from that, move towards it. It feeds your soul more than anything else. You know, I'm passionate about nursing and what I do, and passionate about wanting to create a change and wanting to see some things done differently. The biggest one, that we treat each other with more respect. I got into nursing way back in the 70s. It was always that we were going to do total care, holistic care. We were going to treat the whole person. So fast forward 40-some years later, the only two places that I see we treat the whole person, hospice and a CCRC. Joe? To be a nurse is, I'm grateful. I'm grateful that that's what I was called for. And I'm grateful that I answered the call.
I started working overseas having just been a brand new nurse. 1 year out of nursing school, I was running codes. I was giving recommendations for medication dosages for children, and it just really hit me heavily. You know, if I went back to school, there's so much more I could do. And considering whether or not I would work in a developing country long term, I started thinking, where can I do the most good? I drive 2 hours to work because there is no pediatric ICU where I live. I live in an underserved area. I hope to open a clinic in my underserved area and serve the marginalized right in my own backyard.
I still work with the same types of stigmas that we worked with 30 years ago. The saying that you should get your care over there, you know, those people, those patients, we still use that language. And they're not those patients, they're our patients. I think we face as nurses huge challenges, and how do we negotiate and take advantage of the technology that we have without losing that art of nursing? A lot of the talk that people have now that social determinants of health has become this huge concept. That's what we're doing. It's clinical transformation, it's teaching, and then we're looking at outcomes, and this is how we make our communities healthier. This is how we solve the problem of the American health system and the poor health of the American population. When I see people who came to our clinics or came into our programs, and then 10 years later, I see them and they're still alive, it's the art of nursing.